One of the cleanest hitters of the ball. Incredible. 13 past 10 now. Some important legislation, and it would have been a pretty emotional night for a lot of people, given this has been quite the tussle in relation to the legalisation of medicinal cannabis. Now, we're told that some of the key ingredients have been removed from it. There's talk that the drug effectively will be downgraded. It'll be known as a controlled substance class, which puts it in the same category as morphine. Dr. Ross Walker, our host of Healthy Living, is also a non-executive director of MGC Pharmaceutical, which is one of the companies that may well be able to produce medicinal cannabis. And I'm pleased to say he's on the line. Dr. Ross, good morning.
Morning, Stu.
Nice to be able to chat with you. How significant do you think the passage of that legislation is overnight?
Oh, I think it's huge. We're going from something that is really an illegal substance to something that can really help a lot of people. And I think the important point here, and you made it right in the introduction, is that we're not talking about THC, which is the active psychotropic component of illegal marijuana, which in my view should stay illegal.
Right, so that's removed from medicinal cannabis, is it?
Medicinal cannabis is cannabidiol, and cannabidiol is a completely different substance, although it might come from a similar plant.
Right.
And what cannabidiol does is affects things called the CB2 receptors, which damp down nerves and affect the immune system and the gut, whereas the CB1 receptors are the thing that's stimulated by THC and give you the psychotropic effect. So
Right. So this is what helps to effectively deaden the nerve endings, if you like. So it numbs the pain for those end-of-life cancer sufferers.
Absolutely.
Different to the high that someone might get if they're smoking a marijuana cigarette.
Absolutely. It's just because it comes from the same group doesn't mean it does the same thing. So people need to get that out of their head.
Well, that's what I wanted to clarify, because I hear one of the key active ingredients is removed, and then I think, well, if that's the case, how does it offer relief for cancer sufferers?
Yeah.
But that explains it, so it's a different form of the drug from the same plant, effectively.
Absolutely, but it's not just cancer sufferers. 7% of Australians suffer some form of chronic pain, so whether it be arthritis or low back pain or migraine headaches or gut problems, and this has been shown in the preliminary studies done overseas to also be very effective for this. The other big thing is epilepsy, Stu, because there are a lot of people there who are taking 2, 3, 4 different anticonvulsants and are still having epilepsy. And there's a particular thing called Dravet syndrome, which is a rather rare form of childhood epilepsy, where these poor children can fit sometimes up to 10 times a day. And the medical marijuana, the medical cannabis, just melts these fits away.
Right.
And a friend and colleague of mine, Barry Lambert, has donated $33 million to Sydney University for research into this, because firstly, Barry's an incredibly generous entrepreneur, but also his granddaughter suffers Dravet syndrome, and so he has a personal stake in all this. Right.
And so when you talk about epilepsy, can that be heightened by chemotherapy, for instance?
Oh, not so much epilepsy, no, but with chemotherapy can induce quite marked nausea, and the cannabidiol helps the nausea.
Right.
And there's even work to show that, and I'm not suggesting this is the case, but some of the preliminary work suggests that the cannabidiol may even reduce the growth and spread of cancers as well. So across the board, it's very, very good for cancer sufferers.
Would we be better with a different name, do you think, given that medicinal cannabis, I think there are still people who either, if they're regular smokers of joints, think, oh, yeah, beauty, I'm pretty well in the clear now. It sort of desensitises the illegality around the drug, and there will be for some still, even, albeit it's legalised, an element of stigma that this is an otherwise illegal drug in certain forms.
Yeah, I think you're absolutely right. I prefer just to call it CBD or cannabidiol.
Right.
CBD is easy.
Yes.
And we should really start talking about that and getting the whole marijuana thing out.
Move all of that, because I do think it creates a lot of confusion for people who think, well, you know, it's pretty well marijuana, they must get themselves stoned, and that makes them feel better as a cancer sufferer.
Yeah, absolutely. And so when the plant starts growing in Australia, if you jump the fence and steal some, you're not going to get the high.
No, right. And so how would it be administered? Is it a pill, or do you take it in a drink? What would happen?
There are 2 ways we're developing. One is just a capsule that you swallow.
Right.
And the other is a nasal delivery system. So basically just like any nose drops, you just use that.
Okay, so that'd be the 2 ways. And, of course, this is all going to be done under very, very strict controls, isn't it?
Oh, absolutely. This is a drug. It'll be on prescription by doctors. So it's not something we're going to just say people walk down to their pharmacy and buy some CBD.
Yes. Is it a hybrid form of the plant? Is that where it grows from originally?
Absolutely. It's just a pure hybrid of the the cannabis plant.
Right. So what you'd effectively have to, if you were to start growing it in Australia, you'd be importing cuttings or something from overseas, would you?
We're already growing stuff in Slovenia in Europe.
Right.
So we already have that. We would just bring the plants in and start growing them here once it's legal.
Right.
Well, it is now legal.
Yeah, well, that's right. It's legal now. It's one of the few things that passed the Senate, so it passed overnight, which is good news. So you'd grow the plants here, and the plants, the hybrid plants that were here, if some, druggie from Nimbin was to jump the fence, he wouldn't be able to rip a few plants out and have the marijuana that he's come to know and enjoy. It's completely different.
Not in the slightest. You wouldn't have any. You'd get no hypheness whatsoever.
Yeah.
But if you had dreadful pain, it certainly may help your pain.
Yes, and that's where the cannabidiol kicks in, as opposed to the THC, which is the one that gets you stoned.
Absolutely. See, we have this whole thing called an endocannabinoid system in the body that has hundreds of different molecules that work at this level. It's just that the CBD and the THC are the very prominent molecules.
Yes, and so in this case the THC is gone, and that would be why in this case, if we called it CBD, it would effectively be in the same category as morphine, and that would differentiate it from what will still be the illegal marijuana.
Absolutely,
and
with much less side effects than morphine. This has been studied overseas, and for example, about 20% of people might get loss of appetite, maybe headaches or a bit of diarrhea, but they're the main side effects.
Yeah. Now, well, look, it's very interesting, and obviously an historic piece of legislation passing last night, but I think importantly, if we can start to champion the cause of changing the name, I think that will be an important thing in terms of ending some of the confusion for people.
Yeah, no, I totally agree with you.
Terrific, mate. Always nice chatting with you. Appreciate your time, Ross.
Thanks, Stuart.
All the best. Dr. Ross Walker, the host of Healthy Living, and he also happens to be a non-executive director of MGC Pharmaceuticals, which is one of those working towards medicinal cannabis, or CBD, cannabidiol, as he explains. Yes, Gary, good morning.